is delicious. So that's what I had for lunch.
Nice. Dr. Nelson, anything exciting?
I had some beef ribs, just had one and a little bit of piece of another. And then I made myself a ribeye that I cut myself. So it was like 1.5 pounds probably, the ribeye.
Wow.
And that has been my food today.
Nice. What about you, Barb?
So I have to preface this by saying there's a butcher shop in my town that sells the remnants when they cut steaks, anything that doesn't conform to the shape, they sell that and they call it minute steaks, and they sell it for $9.99 a pound. So I actually had filet for lunch with a bunch of butter. And then for dinner, I had eggs and bacon.
Nice. Filet for $9.99. That's a steal.
Right.
Good job.
Lynn, what about you?
Well, Emma, I'm on the West Coast. I haven't hit dinner yet. Dinner is after this call. But for lunch, I had 6 scrambled eggs in lots of butter. And for dinner, I'm probably going to have a T-bone steak.
Ooh, nice. I had a strip steak and 6 scrambled eggs as well. And my daughter Alyssa made it for me too, by the way. Shout out Alyssa. I had to bribe her, but it was worth it. She makes a good steak.
And if you saw your video today, that was an expense. Those are expensive eggs, $1 million eggs right there.
Right. All right. We got a question from RJ. Will most sleep better eating earlier or later in the day? Dr. Nelson, you got any thoughts on this one? Time of day?
Personally, if I eat too close to bedtime, it's a horrible night, usually. I cannot go to bed with a full stomach. Do I sometimes? Yeah, because I didn't eat during the day and I'll have something. That's how I know the answer. So personally, I can't. There are other people who can eat late and be okay. If you go to studies, most studies show that you're probably better off eating earlier in the day, at least during the day. But when we talk about, eat before sunset, you cannot, if you live very high, if you're in Alaska and Canada, very high in the hemisphere, very low in the hemisphere, you cannot depend on that too much because your days may be very short or very long on different times of the year.
Yeah, it really should be based on when you go to bed. At least like 3 hours before you go to bed, stop eating.
Yeah, I need at least 3 hours myself.
Yeah.
All right. We are going to be doing a drawing for Healing Humanity shirt in a couple of minutes, so make sure to post your best question with #ribeye. Deborah has a question. Barb, what do you think about this one from Deborah? I'm on day 10 of carnivore, and I'm dealing with excessive mucus interfering with me eating. I'm only eating steak. I've eliminated everything else, and still I'm getting sick when I eat.
Okay, 10 days carnivore and dealing with excessive mucus. So I'm not sure, Deborah, are you saying that when you eat, like your nose starts to run or you're having sinus drainage? I'm not really sure on exactly what's happening. And I'm going to be honest, I haven't heard anybody say this in this way before. So I'm going to Dr. Nelson, what do you think?
Well, I don't understand the question either because it says I'm dealing with excessive mucus interfering with me eating. So is that happening before you start eating? Or is it only after you eat that you develop excessive mucus? But I'll punt it to the histamine intolerance and MCAS expert here because I don't know if she can clarify, but maybe.
Yeah. Well, I have a couple of thoughts. With the mucus, I have had issues with mucus. Day 10 is still definitely very early on, so not sure how much of that is your body still kind of detoxing and cleansing, or if you're actually having like a reaction. And I have had histamine reactions with meat depending on how fresh the meat is. And so when it comes to mucus building up, and you're not eating dairy, you said you're only eating steak. So I would be looking at the freshness of the steak and make sure it's not smoked and it's not aged and that it's really fresh. And if you could also try varying the meats that you're eating, because sometimes it's hard if it is a histamine issue, you may have to play around with where you're sourcing your meat, the different cuts of meat, and just kind of play around with it. So maybe do a little trial and error. Does this happen with ground beef as well? Does it happen if you eat, different cuts of the steak? Try maybe a different store, a different brand. But I would say absolutely make sure it's very fresh, not aged or smoked, and give that a try and see. But drink plenty of fluids, and hopefully this is just something that's going to clear up as you get further into it. But please keep us posted and let us know. And because this is something that not everybody experiences, but I definitely know that I do.
All right. Hey, look, it's our friend Barbara, Grandma's Crochet Corner. Total weight loss on carnivore has been 130 plus pounds. Still have lots to go. Started over 400 plus pounds, and I am 9 months strict carnivore now. 270 days carnivore to be exact. Happiest days ever.
Yeah, we just saw her and we were commenting on how she's aging in reverse. She's looking amazing.
Yeah, she's the best. You guys should check out her YouTube channel, Grandma's Crochet Corner. She does a live stream every night.
And she writes amazing songs.
Yes.
Hello, Barbara.
Julie says, hashtag ribeye, I feel with carnivore, you become the best version of yourself, both physically and mentally. I agree.
I agree too.
Definitely.
I agree too. I agree 3/4.
All right. We got a question from Diana. Since being on carnivore, is it normal not to be hungry? When eating the other way, was always hungry, like every hour was crazy. Ashley, what do you think about this one?
Yeah, I think it's absolutely normal not to be hungry. And I think that's one of the keys that sometimes we've built such habits of eating 3 square meals a day that, prior to the last 100 years, that was not the norm. And I think it's absolutely fine to eat when you're hungry. Listen to your body. You're doing the right thing by listening to your body. But protein and fats are so much more satiating that, especially with that initial transition phase, there's a lot of people that say they just don't get those same hunger cravings and pains the same way. Now, that's not for everybody, but those who don't have those hunger cravings, yeah, it's perfectly normal to eat less and less frequently. Now, I will caveat that with also saying, and I feel Lynn about to say the same thing here, that it's important to eat enough as well. So, you don't want to see any negative side effects happening. And if you feel that, or if you feel some negative side effects happening, you may not be getting enough nutrition. Just because your body's not giving you the same hunger signals doesn't mean it doesn't need more nutrition. So be careful on that too.
Yeah.
Would you agree, Lynn, there?
Yeah, and carbohydrates don't trigger those hormones that satiate you. And so that's why you can eat carbs and still be hungry, or you may feel like you're satisfied because your stomach is full and some of the the stretch receptors kick in, but then you're hungry again a couple hours later. So the protein and the fat actually do trigger your satiety hormones. So that's why you're feeling satisfied. It's a good thing.
All right. Question for Dr. Nelson. Does carnivore clean out the plaque in your arteries?
I don't think there's any evidence of that. There seem to be some people that claim that their CAC score has reversed.
Mm-hmm.
I don't think there's any studies that show that, but it's very unlikely that you're going to have, if you're doing a very low carbohydrate diet or a carnivore diet, there doesn't seem to be much progression. And yes, if you have plaque, it may progress even if you're on a very low carbohydrate diet. Watch the cholesterol code movie.
Well, and
But-
Dave Feldman did a study,
Hmm.
that he reviewed in the cholesterol code movie where they did see regression of plaque, and these were people on a ketogenic diet. We haven't had any. I don't think we've had any studies with people on a carnivore diet, but on a ketogenic diet, they did see regression.
So there wasn't regression in the initial results. When they discovered that someone had messed up, I'm not going to give the whole description. Go to Dave Feldman's channel. You can find it there. But in the movie, there wasn't any significant regression. But after they analyzed the mishandled evaluations by the AI, there may be something there. So they have retracted the CTA, keto CTA study themselves to evaluate the data, because one of the companies that evaluated the data gave them the wrong data, and then they don't want to redo what they are supposed to redo. So even a lawsuit, I think, has been filed and everything.
So was that the company that did the analysis that showed that there was about 30 people who had less plaque? That data was not correct. Is that what you're saying?
The company was clearly, but I don't have all the details, so I don't want to give more details.
Yeah.
That the thing is, with apparently the correct evaluation, the study may have shown some regression in some people.
Yeah.
You cannot claim just from a very small number that this diet does regression. But I think I'm very confident in saying that you're probably not going to have a lot of progression. If your CAC score is 0, your chances of having a heart attack in the next 5 to 10 years are nil. Listen, you can have a heart attack, a stroke, and all these catastrophic events at any age and with any diet, but you have reduced your risk to almost nothing if you have reversed major metabolic diseases like diabetes, metabolic syndrome, hypertension, obesity, all these things that carry much more risk than having a cholesterol that may be high and within the right context not be important.
Yeah.
Still the #1 killer in the world.
Yeah. But diabetes is definitely a much bigger risk factor.
Oh, 10 times almost.
Okay. Here's a follow-up from Deborah. She said, no, I'm vomiting up the mucus.
Okay. So, yeah, so that sounds like that's a gut issue. So vomiting, not coughing. So that means it's coming from the stomach. So maybe a digestive issue, not quite fat adapted. I don't know. What do you think, Dr. Nelson?
Well, it's be only 10 days, so
10
I don't
days.
know if we can blame the carnivore diet. It could be, and it might be on the basis of having some histamine intolerance. She's not having dairy, which is commonly something that may cause increased mucus.
Yeah, I'd be curious to know, Deborah, if you went cold turkey into carnivore, or if you gradually went into carnivore. If you did go cold turkey, it might be helpful to maybe back off a little bit. Or if you're doing really fatty cuts of meat, maybe go down a little bit on the fat until your body adjusts. You could possibly also add like some ox bile. Not sure if you have your gallbladder or not, but maybe add some ox bile just to help with digestion. There's definitely some things that you can try and see, but I would definitely try the different meats and make sure the meat is really fresh.
All right. Hey, we got Adam. Welcome, Adam.
Howdy, everyone.
Hello, my friend.
Crash the party.
Let's find a good question for Adam. Let's see what we got.
Oh,
here.
no.
Put him on the spot right away.
No, this might be a good one. What is your favorite jerky?
Carnivore Brothers. Easy.
Woo!
Next.
I'm going to give that one to Ashley too.
Yeah. Ashley disappeared there for a second. That was
There it
wild.
It is.
There
I
it
was
is.
trying to show the label.
Ashley,
we-
where can people try Carnivore Brothers jerky?
Well, right now, whenever we go to Healing Humanity event, we try and sell our Carnivore Brothers jerky to help raise some additional funds for the documentary. It's been a fundraising effort, and telling you, it's been a hit. My brother Rhett and I are working behind the scenes to try and make it happen to where it's more readily available. But it is literally just beef, salt, and smoke. If you're going to be at MeatStock, we'll have some there. You definitely want to come by and try it. But yeah, we love it. It's super simple, and all the jerkies that you get, almost all the jerkies you get in the store, there's so many different ingredients. A lot of them marinated in soy sauce. Almost everything I know has sugar in it. So if you're trying to find a jerky, just make sure you really watch those labels, because even though it tastes great, there's a lot of times a lot of extra things in there that probably don't want on the carnivore. Again, it's better than a lot of the other alternatives that are out there. However,
right.
just watch the ingredients.
Your
We got a
brother's
comment
there.
from the other Carnivore brother.
There you go.
You better pipe up an answer for this one, brother.
Hello, Brett.
My answer was going to be homemade, but actually the true answer is Ashley's jerky that he makes homemade for us. It's incredible. Yeah, it's really tricky with jerky.
If we ever run out when we're selling it at an event, just blame Kerry, because he typically eats it all.
Yeah, that's right.
Or my husband.
All right, we are going to do our first drawing of the night. Thank you for your questions and your comments. We want more questions and testimonies, so keep posting with #life. But right now, we're going to give away a Healing Humanity shirt in color blue. Here we go. The winner of a Healing Humanity shirt in color blue is No Carnivore. Adam, how can No Carnivore claim their prize?
Well, Carrie, No Carnivore can go to healinghumanity.movie/giveaway. Fill out the form, and we will promptly send you your shirt. Congratulations. Sorry, I'm a little slow. I just got here. It's all good.
Congratulations. And we're doing another giveaway. Keep the questions and the comments. Like, we love hearing your testimonies, your testimony of healing. Post it with #life, and we will be giving away 1 month free membership to healinghumanity.life, our membership site. We're very proud of the work we do there. We do about 12 Zoom calls a week. We had on the amazing Dr. Jocelyn Foran yesterday. Wednesdays, we have a doctor expert. Tuesdays, Q&A. Thursday, Inspire Together. Sunday, you can hang out with Dante Ferrigno. We've got courses and community to put you on a path to healing. And if you don't win, you can get 50% off right now using the code scrolling on the bottom of the screen or the link in the description below. All right. Our next comment is from David B. Knott. Yes, many different meds, dozens over the years, many different diets, not including carnivore. 24 years of dealing directly with extremely painful neuropathy. And today, David had 6 eggs and 2 T-bones. Nice. Well done. Congratulations on your healing, David. All right, here's a question. Ashley, what do you think of lamb meat?
Well, there's certain cuts of lamb meat that I do like, but I honestly am not a huge fan personally. I think it's a great choice for a lot of people, and a lot of people do seem to like it. To me, that there's a taste in it that I'm not a huge fan of. Now, there's varieties that I have not tried that I heard are, I guess, more similar to a beef flavor. I know Dr. Berry talks about his hair sheep, and I'm anxious to try that at some point. But most of the time, I'm just not a huge fan. I do like, and I don't know why the name's slipping my mind right now, but they look like little mini T-bones of the lamb chops that are sold at Costco. I've gotten those. I really do like those, but just a leg of lamb or something like that, kind of hit or miss for me. Mostly miss.
I
But
like
it's good for you. Yeah.
Barb, what do you think of this question from Peaks to Palms, day 6, struggling to eat, not hungry? Is it okay to just eat to hunger?
if you're just on day 6 and your body is trying to get used to eating this way, I think you can eat to hunger, but I'm going to give the caveat that because carnivore is so satiating, like we were talking about earlier, it's easy to undereat. So you want to make sure that you're getting enough protein and enough fat and enough energy, even though you might not feel hungry. So I would say, in the transition time, eat when you're hungry, but maybe next week, just kind of jot down what you're eating and take a look and try to make sure you're getting enough protein and enough fat. I don't know your height, weight, any of that, but I mean, a good measure on protein is just to be easy, say 1 gram of protein per pound of ideal body weight. So if you want to be 150 pounds, 150 grams of protein. So just kind of keep an eye on that. And as your body adapts, you'll get more of an idea of what you should be eating, and your appetite may open up.
All right. Thank you, Barb. We got a question from our friend Amy Hosp, Carnivore in Secret. I'm going to try to pronounce this right, but Dr. Nelson's going to correct me when I screw this up. Question for Lynn. What is the difference between famotidine and omeprazole?
You did pretty good, Carrie.
You're good? I just went fast and I committed to it. And how might carnivore help you not need these even if you have mast cell activation syndrome?
Thanks, Amy, for the loaded question. So famotidine, so both of these are acid blocking medications, and that's how they're usually prescribed by doctors, is for acid reflux. Famotidine is an H2 blocker, and omeprazole is a proton pump inhibitor. So omeprazole is a stronger acid blocker than famotidine. It will block about 90%, famotidine about 75%. But when it comes to mast cell activation syndrome, a lot of people who have MCAS, when their mast cells are still highly reactive, having famotidine on board is helpful because we have a ton of H2 receptors in the gut, and it can absolutely help with gut symptoms. I usually talk to people, make sure that they have both an H2 and an H1 blocker just to kind of cover their bases if you have, reactive mast cells. So how carnivore can help you not need those is basically by eliminating a lot of the things that cause reactions and helping create and sending safety signals to your body that it is safe for those mast cells to settle down. And sometimes you need the medications to kind of help with that process. And I was able to wean off of mine, but I would not worry about omeprazole because when it comes to MCAS, omeprazole is not going to be what you need. You would need the famotidine. And then once your body is recovering, your mast cells are settling down, it's a matter of continuing to give the safe environment with the proper nutrition, but also rest, exercise, sunlight, stress reduction, all of those things to help give your body the sensation of you're safe, my mast cells can settle down. Dr. Nelson.
I have a follow-up question since you mentioned H1 and H2. So which ones are the H1?
So H1s are things like Claritin, Zyrtec, Benadryl, although do not be on Benadryl regularly. There's a whole list. They're basically what are considered the allergy medicines. So
almost everything else, old and new, that is sold for allergies is H1. Mm-hmm. And then the H2 came to the market as acid reducers, but they are antihistamines.
They are antihistamines, right?
It's just that they are different. They are H2 and H1 and H2 receptors.
Yeah, the H means histamine. Yeah. So they're antihistamines.
All right. Here's a good question for Dr. Nelson. Last week, I was diagnosed with severe non-alcoholic fatty liver disease after an ultrasound. Is this fully reversible on carnivore diet, even if it is advanced?
Well, if you ever flew a plane, you might be familiar with the concept of point of no return, right? So not knowing how severe, but yes, you still would try eliminating basically every carb possible. I think a carnivore diet would be that ultimate elimination, and just keeping your carbs near zero. Now remember, there are carnivore foods that have carbs like eggs and cheese, all the dairy at different portions. Even meat has some. It's very small amount, almost negligible, but even meat has carbs. So I think that's the number one strategy to help reverse a fatty liver. It doesn't matter what stage it is. Now, when I say the point of no return, if there is enough damage in the liver where there is already enough fibrosis, or you have gone into cirrhosis, you may not be, but still, what I would recommend to someone like that would be cut all the carbs. But
Yeah.
Just give it a try. 90 days probably would, you might not be able to do in 30 days, but even 30 days or 90 days, have some tests repeated and see if you have made an impact.
Yeah, and I would say follow up that ultrasound with the fiber scan, because the fiber scan is going to tell you the extent of both inflammation and scarring on your liver. And so that's going to give you that information that Dr. Nelson's talking about how much fibrosis do you have. It's going to give you a score for inflammation and a score for fibrosis. And so it'll be an F0 to F4, and F4 is cirrhosis. But even for people with cirrhosis, like he said, eliminating all carbs is going to be helpful. But getting that information will be helpful just to see what stage things are at with your liver. And I absolutely agree. Cutting the carbs is going to help. And if you want to check out Coach Lisa Pickert, she has a personal testimony of her husband who was diagnosed with very severe acute cirrhosis and came back from it with a carnivore diet.
All right. Thank you. We have a question from Lisa. Carrie, did you decide if you plan to add a second showing of Healing Humanity at the world famous Montello Theater on June 6th? We haven't decided that yet. No, but we are still we have a list going. So if you're interested in attending, the first showing sold out in like 2 days. If you go to the page healinghumanity.movie, click on events, there is a waiting list you can click on. And if we get enough people to sign up, we will announce a second showing. We haven't hit that threshold yet.
Will you do it on the same day or the following day?
We haven't decided yet. Probably the following day, Sunday. Yeah, the 7th. I got another question here. Carrie, what is the name of the soap that you use? The tallow stuff that is called Beast Mode Soap. Beast Mode Soap.
I didn't know you used soap.
From time to time. If I got to go to a big event like MeatStock, I'll use a little bit.
There you go.
Maybe another question for me. Anyone trying to carpool to MeatStock from Wisconsin? I'm from Wisconsin. I'm going to MeatStock. Unfortunately, my vehicle is going to be full. In fact, it's going to be so full, there's not going to be enough room for the 4 people that are going to be in the vehicle.
Emma has to ride on the roof.
Yeah. I don't know if anyone else is traveling.
The triplets will take turn at that.
Yeah. I can hear it now, Dr. Nelson, the drama in the back seat. Why do we got to take all this stuff with? They're going to be under a ton of Healing Humanity cutting boards sitting in the back seat, and a couple cases of Beast Mode soap too, probably. All right, Bucky Badger. We'll start this one off with Adam. Anyone else on the panel tried cod liver yet? I know one did.
Actually, 2 of us. I'm just the one that filmed it.
I tried it.
Look, I come prepared.
Are you going to do it here?
I was ready for you, Bucky Badger.
Oh my goodness, he's going to do it now.
I was ready. I'm going to try not to spill it. I've got my fork.
Oh, here we go.
Oh my goodness.
You're going to need a content rating on this.
Censor it out.
Actually, honestly, it's pretty darn good. I'm a fan.
Yeah.
Okay.
Affiliate link below, right?
I'm a fan, right? No, actually, not bad. I'm going in for another bite.
Cod liver coming soon.
There it is. Bucky,
Wow.
that's for you.
I'm impressed.
I've been waiting. I've been ready.
Barb, what was your take on the cod liver?
About the same as Lynn's. There's just not documented evidence.
I had a wave of nausea when it hit my mouth, but it's all very individual.
Right.
It reminds me honestly of kind of an oily tuna.
Yeah.
I mean, it's not horrible.
Very soft.
Yeah, very soft. Actually, I really like the texture.
I heard people will spread it on, well, if we wouldn't spread it on toast. If you make carnivore bread and toast it, people spread it. Yeah.
There you go.
All right. Next question for Adam. Just another carnivore is asking, what should I feed my 13-year-old Jack Russell and how much? She had some sudden behavior changes. Vet suggested a specialized kibble for neuro issues that has more ingredients than her current kibble.
That's a good question. And, you know, I might, in this case, probably lean a little bit more on your veterinarian for guidance here. But if you wanted to look on your own, there's a website called hare, HARE-today.com. And they have calculators basically for the age and the weight and what type of food you want to feed your dog. And if there's any additives that you need to add to it based on what you are giving them. If it's like a bone-in grind or something like that, you may not need to add calcium. So, but they lay it out all on that website, like absolutely anything and everything you would ever want to know about quantities and types of meats and stuff like that. So I definitely would recommend going there.
I would look up Dr. Judy Morgan, which I think you've had also on your channel, Carrie, right? Or not? But anyways.
No, not yet. No.
She's a veterinarian. I think she's maybe retired, but look at her website. She believes dogs should be on a carnivore diet.
All right.
And commercially available kibble is not carnivore, definitely.
Yeah.
It's basically
dogs can't handle the high fat. So unlike a human being that had neuro issues where we would be, you know, promoting high fat, you can't do that with dogs. Their digestive system can't handle it. They don't have the same
actually she clarified that for us, they cannot handle the rendered fat as well as they can handle the raw fat or the fat that comes with
fat that comes with it. Yeah.
All right, Susan. Hi, Lynn. On an earlier video, members only, I listed my blood test results from 2 days ago and would love to run the numbers across to you. It's Susan, if you wouldn't mind posting them here.
Or if you want
to. She just did, I think.
Oh, did you?
One of the last starred ones.
Here we go.
And of course, we got Dr. Nelson too. So,
yeah. Hashtag ribeye. Okay to mention suggestions to heal. Suggestions to heal and improve my next blood test in 6 months. Normal, acceptable A1C 5.4, triglycerides 129, HDL 50, lipoprotein A31, kidney plus liver panel was normal.
So the triglycerides, so I would need to know a little bit more about, like, how are you carnivore? Basically,
how long?
Yeah, how long exactly? So your lipoproteins are pretty low. Don't you think, Dr. Nelson, that that's kind of low? I mean, when you go carnivore, your lipoproteins are going to go up. I mean, those are your little taxis that transport fat.
Well, the lipoprotein A is mostly genetically predetermined. So if it's 31, it's not LDL.
Yeah.
And if I remember correctly, she was relatively new into carnivore.
Yeah. I would say do a 6-month follow-up because your triglycerides on carnivore are going to come down. And your HDL is pretty much on that lower end of good for a female. And so you should be seeing the HDL going up and the triglycerides coming down. But if there's any concerns, if you want to on your 6 months, ask for an advanced lipid panel, just so that you can see the quality of the LDL particles. And hopefully your doctor may or may not order insurance isn't going to cover it, but if you're willing to pay out of pocket, that would be really helpful to get. But if you just started, you should be seeing that triglyceride to HDL ratio improve, and you want it to be, depending on the doctor you talk to, some say under 2 is good, some say you need to get it under 1.5. A lot of times they'll say optimal is around 1. Mine was 3.2 when I started, and now it's 1. And so just, I'd say a 6-month follow-up would probably be enough time for you to see the benefits. And your A1C is great.
All right. We have a question from Susan. How does one get rid of all the wrinkles from losing all this weight, stomach, legs, and arms? Not so much in the face. In early 60s and have lost 80 pounds over the course of 16 months. Any thoughts on this one, Dr. Nelson?
Yes. Kind of a sarcastic coming initially, but I'll get to a serious one. Find a good plastic surgeon. No. That's going to happen. Unfortunately, especially if you're losing a lot of weight, you will get wrinkles, loose skin all over. And unfortunately, there isn't a surefire way of getting rid of them, although improvements might happen better with people who are exercising regularly. And some people are not able to really exercise at the beginning a lot. Drinking water. I didn't have almost any wrinkles in my face when I was this way. When I was really fat, and then as I lost fat on my face, a bunch of wrinkles developed. Red light therapy might be one of the things that you want to use if you have a lot of facial wrinkles. That might improve, and that there is good evidence that it helps. But if you lost 80, 100, 150 pounds, you're gonna have loose skin, and some people report improvement with fasting as well. But I don't know that I would hang my hat on any of those and tell you 100% that they're going to go away with any way you try.
All right.
And ultimately, plastic surgeon, but I really wouldn't do surgery. Do I have some low skin? Yeah, but I don't miss all the chronic diseases.
Absolutely. All right. Here's a question for Lynn. Am I the only one that doesn't feel satiated? I like to eat 2 meals because it's easy, but I'm wanting something in between and through the day. Is this because I deal with histamine intolerance?
Well, not necessarily, but if you're really limited in what you can eat because of histamine intolerance, you may not be eating enough. And I know I definitely struggle with eating a lot at one time. And so, if you've been historically one that did a lot of dieting or under eating, you can get satiated pretty fast. And so if you're feeling as if you're needing more, but yet you're just like, you feel full, but then you're not satiated, I think it's okay to eat more meals during the day. You don't have to just eat twice a day, but just whatever if you feel hungry again, eat more carnivore foods. And I don't know that it's necessarily related to histamine.
However, if this snacking or food in between the main foods or the main meals, it's a habit and not really that you're hungry, you need to determine that and be truthful to yourself. I mean, are you eating because you just feel like you have to put something in your mouth, which is probably out of habit, or are you really hungry?
Yeah. And is your fat percentage enough? Is it 70% of your calories, or is it low? That could make a difference. And like Dr. Nelson said, if it is habit, maybe start with drinking a glass of water and seeing if that helps. Sometimes it's thirst and not hunger. Maybe you may need more sodium, or maybe try a little bit of butter in your mouth, see if that helps. There's definitely a lot of, like, the thing with, answering the questions in the comment, there's so many other questions we could ask to try to narrow it down. But those are just some thoughts.
All right. And Susan, $5 super chat. Thank you, Susan. Follow up for Lynn. Could I share my blood test with you and plan to improve in the next 5 months?
Yeah, she's the one who brought in her blood tests that we talked
Who's
about.
having internet signal problems.
Yeah.
All right. Diana is asking, what cookbooks are truly carnivore for different meals? Anyone here on the panel got some carnivore cookbooks?
I've got Courtney Luna's,
Yeah.
and I have Maria Emmerich's, but Maria Emmerich's has some that are more keto. She does designate which of her recipes are keto versus carnivore.
Dr. Nelson's got Jenny's book.
And there's Jenny's. Yeah.
Jenny made it carnivore. Complete
Now,
carnivore.
Complete carnivore.
Now, am I wrong in that Courtney Luna and Jenny Midishes also have some keto recipes in there too? But I think
Yeah.
they specify and highlight that. So
Yeah, and I know with Courtney's book, she's pretty good about making sure, there's like, okay, well, if you want to do it carnivore, here's what you do, here's what you change.
Nice. Yeah, and Jenny's, if you missed Dr. Nelson holding up, is complete carnivore. Complete carnivore. All right. We are going to be doing a drawing in just a couple minutes. If you got any more questions or testimonies, post them quick with #life. Tom and Nina, has anyone tried not washing their hair, only rinsing? I know a carnivore that has gone over a month and the hair looks great. Jen won't allow me to answer this question. Anyone else? Dr. Nelson?
I think you have to answer this
Dr.
question.
Nelson,
I don't.
Me and Dr. Nelson. I pretty much just rinse my hair. Unless I go to MeatStock, then I'll use some beast mode soap on it. But yeah, I really don't. I know it sounds crazy to a lot of people, but it's really not when you think about it. There's all sorts of chemicals and detergents, and it's pretty crazy how miraculous the human body is, but you need to put some sort of chemical detergent in your hair every single day. It seems to like strip out all of the natural oils and things like that. And when you just rinse it with water, your hair gets pretty healthy. I don't know. That's my feeling on it. A lot of people don't agree, but
If you want to find a female that does that, check out Serena Musak. I think it's Carnivore Revolution. Her hair looks great, and she just put out a video about that, about how she doesn't wash it.
oh, nice. All right. Let's see what we're at here. Oh, we got another super chat from Susan Lydia. $10. Thank you, Susan. Her training 2 times a week since November and started walking again. I need to be strict. Also losing weight, which will improve my blood pressure. Cardiologist pushes statins badly. Thank you, Lynn and team. Awesome. Thank you, Susan.
yeah, sounds like she's doing everything right.
Yep, she's on the right track. That's a good thing.
Yeah.
And I think,
It's your decision whether you go on the statins. So the cardiologist is going to push it, but you are the patient and you have a right to decide what you want to do.
all right.
Tell your
Here we
doctor to
go.
watch the cholesterol code.
There you go. Do you drink ginger tea? Do you think ginger tea would help her digestion as well? Peppermint tea too. I'm not sure which one this was in reference to. Anyone do any tea here on the panel?
Maybe the mute
Well,
question.
I know that working in GI, those are 2 teas that we did recommend, but it depends on what's going on with digestion. So ginger tea is typically, we would recommend that for nausea. And that could be from not digesting well. You could potentially have some poor fat digestion, possibly some gastroparesis going on. And so ginger tea can definitely help with that. A lot of people do find benefit from it. Peppermint tea was usually more of a recommendation for someone with irritable bowel syndrome. potentially, if you're having acid reflux issues, it could potentially make that worse, because peppermint is one of those foods that loosens the gastroesophageal sphincter, allowing acid to reflux more easily into the esophagus. So I'd be careful depending on what you're needing it for.
Yeah, it can definitely cause to some people some heartburn.
Mhm.
The peppermint. Growing up, my mother would do ginger and lemongrass, and whether just water or just sometimes or do it in milk, and that always helped me. I still might use a ginger tea if the rare occasion I may have some stomach upset.
All right. Here's a question. Dr. Nelson, what do you think about this one? My wife, now carnivore, just finished 2 rounds of antibiotics for kidney stones from previous high oxalate diet. I'm making homemade kefir. Will carnivore feed her microbiome from the kefir?
So there is, obviously, to make kefir, you're adding the bacteria they are growing it. So the answer would be yes, you can use kefir, yogurt, all these fermented foods, basically. It might be helpful. I don't know if after the antibiotics you're having some GI problems, because the antibiotics very often will kill off a lot of the bacteria. But a high-fat carnivore diet also suppresses the microbes in the gut, and your microbiome changes with the diet accordingly. But specifically about the kefir, yeah, it will probably help.
All right. Thank you, Dr. Nelson. All right. We are going to do our drawing right now for 30-day membership on healinghumanity.life. Here we go. The winner of a Healing Humanity membership, 30 days, healinghumanity.life is Lisa Russell Z3I. Adam, how can Lisa Russell Z3I claim her prize?
Well, Carrie, Lisa Russell-Z3I can go to healinghumanity.movie/giveaway, and Lynn will promptly send you your code for a free month. Congratulations.
Congratulations. And again, if you didn't win, you can get 50% off right now. Code on the bottom of the screen and in the description below. Thank you, everyone, for your questions. Adam, Ashley, Barb, Lynn, Dr. Nelson, do you guys have anything coming up you want to shout out or mention?
I do. And it's not MeatStock, but it is. So that also, this weekend, I'm going to attempt to shoot or photograph practically the Healing Humanity poster art. So I'm going to try to roll some footage of that, like sort of behind the scenes of what that experience is like for everybody, and probably post that on the Healing Humanity YouTube channel. I'm very bad with getting videos out right now, so just pray for me that I'm able to get something that is going to be interesting enough for everybody. But it involves steaks, so I can get that out there.
There you go.
Nice. Awesome. Anyone else got anything exciting coming up?
Yeah, I've been bad too. I did post my video with all the before from our property, our house, that we moved into, and I definitely need to get the after done. And I'm flying out tomorrow morning to Las Vegas, and on Saturday is my 40-year high school reunion. And most of these people haven't seen them since our 10-year reunion, so it's going to be interesting. I was already at that point about 100 pounds overweight and pretty sick. So I'm actually excited to go to this one. I've purposely missed the rest of them between the 10-year and this one.
Look at you. That's great.
Yeah, good for you. That's awesome. Barb, you got any new interviews coming up?
Right now, I am MeatStock focused. So it will be after MeatStock that another show comes out.
Nice.
Yeah, we don't have anything coming out immediately, but after MeatStock, we'll get another behind the scenes look at some of what was going on at MeatStock, because we got a lot going on. There's a lot of meals going to be cooked. Rhett and I are cooking a lot of the meals there, and then of course with the Healing Humanity screening, it's going to be a lot fun in the background, getting all that ready to go too. So if you're going to MeatStock, make sure you come visit.
All right. And Dr. Nelson.
In 13 days, which is a few days after MeatStock, is the cholesterol code screening in Orlando. Those of you that are close or have family close or anyone, I know one of the people that it's right now in the comments, so I'm not going to call her out, but she had bought tickets and is not going to be able to attend, but you can still help us by getting some people interested in going. So it's the 6th of May at 7 p.m. in Altamont Springs, which is basically Orlando area. And I have already 2 doctors confirmed. There'll be 3 at least, because I'll be there, and I may have one more. So we'll have a little Q&A after the movie. That's going to be it. But if you're near Orlando, want to travel to Orlando, come and watch it with us.
Yeah, highly recommended. Go check it out. And we got one final question from Susan for Adam. I wish I had time to chat in your private group. If I was a member, what does it entail? Do I post a comment, listen, or lurk when I have time?
Yes, to all of the above. And it also comes with roughly 11 or 12, I don't remember exactly, Zoom calls a week. We have breaking addictions courses calls. We have courses. We have the community, obviously. We have expert calls on Wednesday. We have standard Q&A on Tuesday. We have our Inspire Together on Thursday. We have our Healing Humanity, the Great Steak Escape Hangout on Friday for 2 hours. We just get in there and hang out with like-minded people and have some fun. Same thing on Sunday with Dante Ferrigno. Yeah, it's a lot of fun. So yeah, you can post your questions anytime. You can connect with people just like it's Facebook, but it's a really private group. So we don't spam you with ads or anything like that. You're free to be your crazy meaty self if you want to in there. So that's basically it. And you can hit like anytime. I'm kidding.
And Susan, I'll just add one other thing. It's also great in the community because oftentimes there's lots of back and forth and follow-up questions that need to be had. So it's a great sort of community to go back and forth and dig deeper on some of those questions you have. So, all right. With that said, thank you all for your questions. Thank you, everyone here on the panel. Make sure you're following Adam, Ashley, Barb, Lynn, and Dr. Nelson. Link in the description below. And we'll see you guys on the next one. Have a good night, everyone.
Bye for now.
Good night.
Bye.